Hi, I'm Dr. Cynthia Clark. I'm an acupuncture physician and applied clinical nutritionist and the creator of Energy Evolution. Recently, one of my patients came to me for hair loss. And as we were working on her hair loss, we had an incredible discovery. So she went from having hair falling out every day, a lot of hair in the drain, just a lot of that nagging, annoying hair loss that makes us feel like we're getting old and dry and tapped out, and it's just not pleasant. It also is very stressful. It can cause the body to really get wound up and to get nervous and anxious about the fact that we might be losing the hair, which is really unfortunate because one of the things that can cause hair loss is stress. So she came to me for hair loss, and she had an experience that was very, very interesting. I want to share it with you. When she took the supplements to help to bring back her hair, very interesting thing happened. And it was this: she was on two different blood pressure medications. And what happened was her blood pressure lowered dramatically. Now, I should preface this by saying that it is better not to have to take pharmaceuticals. Sometimes people come to me and they're on low blood sugar medication, metformin, or for insulin for diabetes, and they will start having the experience of their blood sugar correcting, and they go, "Oh no, this is really bad because my blood sugar is really low." What's happening is that they're missing that the healing process is taking place in their body, and their body doesn't need as much medication as it did. And that's good. That's the goal. That's what we want to see. We want to see that the body doesn't need as much medication. That's really, really, really important because every pharmaceutical is metabolized through the liver and the kidneys. Every pharmaceutical is metabolized through the liver and the kidneys, and it wears those organs down over time. So the side effects that you see listed on pharmaceuticals, those would actually happen to pretty much everyone given enough time. If that person was on medication for not long enough. And some people it happens to very, very quickly. And of course, insanely, some of the side effects are even things like cancer and death. Horrible, horrible, horrible side effects. So that's why our goal is to be on as few medications as possible. This is my goal with my clients, and it's what I urge you to try to consider in your own life. Talk to your doctor about trying to be on as few medications as possible because the body needs to heal itself. It needs to come back to its own path in order to be able to continue the healing process. Okay, so this response that her body had was actually so strong that she thought that she was allergic to the supplement. She thought she was allergic because she's like, oh, I'm nauseous and I'm just dizzy and I've got no energy. And I asked if she happened to have taken her blood pressure during that time. And she said, as a matter of fact, I did. And it was about 30 points lower than it is, 25, 30 points lower than it is usually. And usually means on the two different blood pressure medications that she's on. So this is a sign of good medicine. This is a sign of great medicine. When the body starts to heal in one direction, then it starts to bring itself back online overall. When we started to work on hair loss, then we started to see functioning in the body improving overall. So it turns out that the medications that conventional medicine prescribes for hair loss are the same medications that regulate blood pressure in the body. So something to be aware of. And when we corrected the problem, so whole food supplements and Chinese herbal formulas help the body to heal itself. They don't stop processes in the body. They help the body to heal itself. And by bringing those functions back online and restoring the body's health and ability to function the way it's supposed to, then it didn't need as much of this other pharmaceutical. So now she gets to go talk to her doctor about possibly coming off the pharmaceutical that even her conventional medicine doctor was highly recommending that she come off of because it's such a dangerous blood pressure medication. So I want to talk to you a little bit about hair loss today because it's something a lot of people don't know very much about, and there's a lot of different potential causes for them. One of them actually is a gallbladder. And by the way, if you're not, if this, you can be done with this little video here if you don't have a special interest in hair loss. But if you do, or if you know somebody who is struggling with this, know that there are more causes than just old age. That's not an answer. If it affected everybody the same as we got older, then that would be old age. But if it's different for different people, then it's not just age. If you have knee pain and you go to the doctor and you say, oh, I have the knee pain, and the doctor says, oh, that's old age, then ask him why the other knee, which is the same age, doesn't have the same problem. Don't accept old age as a by answer for problems in your body. Instead, be diligent and attentive and keep working on them. Okay, so some of the things that might be happening with hair loss. There's a lot of these, and these are pitfalls that people can fall into. You don't know how to deal with this stuff until you've learned some of these things. And so I want to give you a heads up. These are some challenges, and this is why it's one of the issues that we work with in clinic. One of the first issues is actually people can experience hair loss due to a surgery, especially gallbladder surgery. The reason for this is it disrupts the liver, but it's outside the scope of our time today to go into this in detail. I just want to give you a heads up. There's a lot of different reasons you might be having hair loss. Another reason is a vitamin deficiency, a specific portion of the B vitamin. Synthetic B vitamins do not offer the comprehensive support that food does. So when you eat a carrot, you're getting almost 200 different phytonutrients. And when you eat a synthetic vitamin E, which is called D-alpha tocopherol, then you're just getting D-alpha tocopherol. It's easy for you to wind up in deficiency of other nutrients like selenium, which we talked about on the synthetic vitamins newsletter a couple of weeks ago. Other reasons that you might have hair loss are metal toxicity. Heavy metals can interfere the body's ability to properly create hair. Other deficiencies such as iodine or zinc or iron, all of these can be tied to hair loss. In a Chinese medicine differentiation, we also notice that blood stasis, so a stagnation of the blood, not moving up, not moving fully into the area around the cranium, can be a problem that can cause hair loss. And then, of course, endocrine disorder. So ladies and gentlemen, we can both be subject to this. Thyroids in particular can cause hair loss. And then finally, medications. So one of the ones that can be, just look for the side effects of your medications. One of the ones that can cause it is acyclovir. Another one is Retin-A. Some pharmaceuticals that you use are topical. So be aware that anything you put on your face, on your skin is your largest organ in your body. So you're still absorbing it. In fact, you're even absorbing it faster than you do when you take it in through the mouth. Okay, that can be a topic for another time. I just wanted to give you a little bit of heads up. When you come into our clinic, of course, we go through the 6-step process to identify what the problems are, to get you free of those problems, to get your body back on track, and to clear any energetic disturbances and desensitize you to any further problems that maybe is still existing in your environment. So hair loss, if you know somebody that's struggling with this, then please let them know that it might be more complicated than they're aware of. And if they're having trouble, then I'd love to help them, or please connect them with a holistic healthcare provider in your area. If you have any questions, you can email us you can email me at drcynthialwc@gmail.com. And I look forward to hearing from you. Have a great day.